Time to take your coding break. Hello and howdy, coding pros. Welcome back to another episode of Coding Break. I am your coding break reminder, your medical coding instructor, and the host of the Coding Break podcast. Here to talk about all things medical coding related. So, on today's episode, I want to talk about if I became a certified coder today, what areas would I focus on? What type of medical coder would I be today? So, of course, I went on Google AI, artificial intelligence, to see what's trending, what areas would I lean towards as a newly certified coder. And so I'm going to take a look at it. And so, based on my search in AI on Google, so the areas are home health and surgery coding. So those are like the two areas that I would become hyper focused in once I become a newly certified coder, is really focusing on home health care, telehealth, and then surgery coding. And luckily, and I'm cheering, I am a surgical coder, a surgery coder. And the reason why I say this, because again, according to Google AI, some of the transitions or things that are trending in healthcare today is one, a hospital to home shift, and then ambulatory surgery centers or ASCs are trending. And so let me go back to hospital to home shift. So there's a surge in demand for home health specialists, telehealth, and on-demand mobile responders, which enables patients to recover safely at home while reducing systemic hospital strain. And then you have the ambulatory surgery centers, or ASCs, routine and increasingly complex procedures such as joint replacements and cardiovascular surgeries are moving out of high-cost hospitals and into outpatient centers. So so as someone who is a surgery coder and has been a surgery coder for a minute, yes, some of the procedures that they are mentioning that are transitioning to ASCs, these weren't required back in the day, but now they're moving a lot of these main or more complex surgeries to the ASC, which I'm shocked or excited. So again, if I was a newly certified coder, I would try to gain some experience again in surgery coding or telehealth, home health services coding, because these are on the rise. And then also, if you want to go into, I would say maybe like the DME or durable medical equipment side of things as relates to healthcare, because that is on the rise as well with the remote patient monitoring or the RPMs. These are wearables or biosensors, and connected medical devices are shifting from optimal novelties to mandatory components of chronic disease management. So so a good example of that would be, this was many years ago. I hope I'm not, I was being tested for sleep apnea, or because I snored, or at least I was told that I was caught snoring. And so my doctor decided to do a sleep study test on me. Now, in the past, you had to go into a facility and stay overnight while they monitor you sleeping. But I guess thanks to COVID, they allow you to do that at home. So my provider actually I went to the office and received a device, and they were able to monitor me from home via the device that they had given to me. And then I returned the device after the sleep study, and then of course I got my written results and things of that interpretation by the provider. So this is where we are now. Again, a lot of the things that we would normally go into the facility or go into the hospital to have performed, these things are being done in our own homes, based again thanks to technology and COVID because of the shift. So again, these are some of the areas that I would go into. Again, I would kind of tap into that DME or durable medical equipment. And those codes for the DMEs are, of course, located in your HCPCS coding manual. Again, the HCPCS coding manuals. And then as far as hospital to home shift like telehealth, home health coding, you can find those, of course, in your CPT and probably some of your HCPCS coding manuals as well. As far as the ambulatory surgery centers, again, of course, you're going to find them in your CPT. And then you may find, like, for example, like some of the, I won't say equipment, but some of the, it's not resources, but tools. You know what I'm saying? Like, for example, with the replacements, the total joint replacements, some of the actual prosthetics, okay, those are considered DMEs as well. So you may be using a combination of, again, CPT and HCPCS. And as someone who has audited ambulatory surgery centers, yes, there will be a combination of both. So yes, so again, if I was a new coder, these are some of the areas I would be focusing on or targeting to try to, I would say, gain employment or to get my foot in the door or to gain experience, because as you see, the world is evolving, and as you can see, artificial intelligence is involved, and there's a lot of technology involved in healthcare now. So yeah, so again, these are some of the areas that I would focus on. Again, it would be the DME or the facility, the DME, durable medical equipment sector, home health, telehealth services, or ambulatory surgery centers or ASCs coding. So yeah, so that's all that I have for this coding break. If I think of anything, again, if you have any questions or anything you want me to talk about or you want me to answer, please shoot me a direct message or comment under the video, and I will be sure to address that and to answer it to the best of my ability for you. So again, as always, continue on and keep coding. Until next time, toodles.